Initially, it appeared to be an outbreak of a coronavirus-like illness, meaning that SARS or MERS, the conditions that we'd seen before in the world, where it was flu-like, but it wasn't influenza. And with SARS and MERS, in both instances, SARS having occurred coming out of China in 2003, which we quickly shut down because we understood what the animal reservoir was in the food markets of Guangdong province and got rid of that. And because of the fact people were not highly infectious until well into their 6th or 7th day of illness. And the same thing was true with MERS that emerged on the Arabian Peninsula in 2012. Again, people were not highly infectious until that 5th or 6th day or a little longer of illness. And it was with that we thought, well, that's probably what will happen in Wuhan, is they'll get this shut down based on the fact that they'll isolate these people quickly when their illnesses and they won't transmit to anyone. It was clear that with that first week that it was not a flu virus. They were all negative. Then a coronavirus was found. And on January 10th, that was reported out. So we'll go ahead and knock this one down. The challenge is that around the 10th, we also started seeing more and more information coming forward on what appeared to be transmission to individuals outside of the hospital setting and the community that was not associated with someone who had been sick for many days. So in such, the idea that, oh my, this is not going to be one of those illnesses that transmit 5 or 6 days into illness, but maybe even earlier when they're not yet sick or they don't get sick at all. On January 20th, based on those data, and seeing what was happening with transmission into other areas in Asia, I put out a statement to a group that we advised saying that this was going to be a pandemic, was going to occur. We had to get ready and to move forward. And that was January 20th. Well, as you know, the world still fidgeted around for another 6 to 12 weeks before a lot of people began to believe this. And it wasn't until mid-March into mid-April that we then saw places like Lombardy region of Italy, New York City, other areas really light on fire. And at that point, we got to a high of 22,000 cases a day initially. Then finally, it made it up to about 32,000 cases a day. And we thought, this is as bad as it could possibly get. This isn't a pandemic for like flu, but this surely had challenges with regard to the coronavirus. Well, then we locked down, for lack of a better term. It's not a great term. Trying to create distance between people. So the transmission of what we now know is primarily air shared transmission, meaning I'm breathing somebody else's air is the primary way this is transmitted. And at that point, we recognized that, if we could just keep people far enough apart for a period of time, we could really knock this down. Well, when we did get it down to 22,000 again, it came back down by Memorial Day, but hardly down in a large way, and we gave up. Pandemic fatigue set in, the protests gave people the sense everybody was in the public. Summer was here, and at that point, we realized, oh no, we didn't nearly put the brake down hard enough to navigate that curve ahead. Other countries in the world did. The European countries, the Asian countries, literally got the case numbers down to 1/8 to 1/10 of what we had in the United States. And it was at that point then that we saw case numbers explode. And you're well aware of what happened in places like Florida, Texas, Georgia, California, where we actually saw this incredible outburst of cases. Nationally, cases got up to the 67,000 cases a day in late July, early August. And then at that point, again, kind of you might say prevention kicked in. Those really hot areas, people begin to limit their time together, and we saw the case numbers come back down. But we had a sense that this was just really beginning, because at most 8 to 10% of the U.S. population had been infected to date, and it clearly was going to take many, many more people to get infected and develop protection if we're going to see this virus slow itself down, meaning we had enough immune rods in that transmission reaction, i.e. immune people, that it would slow transmission down. That number probably is well north of 50% to 70% in terms of what we call herd immunity to get the virus to slow down. Well, we again let up, and here we are at Labor Day post, And we're beginning to see major outbreaks in college campuses, universities. Sturgis happened, where we see a number of cases that occurred there, largely associated with indoor air, people in bars, tattoo parlors, casinos, and entertainment venues. And that spread around the United States again. Over 60% of the counties in our country had people at Sturgis. And so the number of cases, while at kind of a low right now relative to what happened in July, August, we believe will greatly increase over the course of the next 5 to 7 weeks. And how high our case numbers will get, I don't know, but surely could easily surpass the 67,000 cases a day that we're seeing now. So this is far from over, and it will continue to burn on if we don't somehow stop it, either through our behavior or through a vaccine. And that gets me to my next point, vaccines. You've heard a lot about them recently. There is tremendous research going on with vaccines here in the United States, Europe, and Asia. At this point, I think all of us believe we will have a vaccine eventually, more than one. But when we'll have that is still unclear, and there has been grave concerns expressed about hurrying this process to get us a vaccine before it's ready, meaning for safety and for effectiveness data. And so we're in kind of a wait and see. I do not believe we'll have a safe and effective vaccine in any meaningful way in this country before the end of the year at the earliest. And then likely over the course of the next year, in meaning 2022, in that area there, we're going to be seeing basically transmission for some time, because it'll take us months to develop enough vaccine to get it out and to actually make it available. One of the questions we have, which we're not sure of the answer of, which is concerning, is do you develop durable immunity with infection? Meaning if I get infected, will I have long-term protection? Will I have durable immunity with vaccine? None of these are questions we know yet. We know with coronavirus this is a challenge. It's been a real problem. And so these vaccines surely will likely offer some short-term, if not intermediate-term protection, but we don't know how much. And it's also very likely that for each of these vaccines, we'll have to give a booster dose. So when we talk about making 300 million doses of vaccine, remember that's just 150 million people. Globally, it's estimated that we would not have enough vaccine until 2024, 2025, which gives you a sense this virus is going to continue to float around the world for some time to come. So we have challenges ahead of us. We're all trying to navigate. Scott very kindly mentioned an article that I co-wrote with Neil Kashkari, the president of the Minneapolis Federal Reserve Bank, in the New York Times, a very unpopular article, which we knew it would be, but we believe it's the honest and truthful means forward. And that is in areas where we still have high levels of transmission, we should be, in a sense, shutting down again. People say we can't do that. It won't happen. Financially, it's a disaster. Well, it turns out that if you look at what's happened during the pandemic, our annual savings rate has gone from 8% to 22% of income in this country, which means that, frankly, if we were to pay for everyone's lost time, meaning no one takes a hit on being laid off, they get their same salary, small businesses are held whole, state and local governments are held whole, we could finance all that out just the increased savings and never have to invest in foreign investment to take that forward. So it really is a very important situation in terms of what we could do. If you look at the economic model, we'll do much better over the long run, even for the next 6 to 12 months. If you look at countries that have really shut down transmission, they're coming back. And on top of that, it's not just country. Well, somebody's got an open mic there. I don't know if they can shut that off. But not only is it an issue of other countries, but if you look at the state of New York, which has, after having been on fire, desperately on fire in April, really have initiated a most remarkable and aggressive program to monitor testing, to have very active interventions with contact tracing and follow-up. And they have remained at less than 1% of all their samples that have been tested have been positive, something no other area in the United States has even come close to. And so the challenge is, do we want to take our lumps now and actually overall have the public be able to go back into public places feeling more safety than they do now? Or in fact, we want to have these increasingly high numbers, which are going to, for certain, deter a lot of business and people going into open spaces inside buildings. So with that, I will close because I want to save time here. We only have 15 more minutes, but the bottom line, this is going to be here for some time. This is not going to go away. People who think this is over with in the next couple of weeks are sorely mistaken. And we're going to be at this for quite some time, even with the vaccine. And even then, we don't know how effective this vaccine will be. So with that, Scott, I'll end and turn it back over to you. And I'd be happy to take any questions or comments.
Thank you so much. That's fabulous. The nice thing about the articles you write or when you're on the news is you're speaking about science. And I've grown up in my work world around science and engineering. The public, what I've learned over the years, by and large, does not understand how science works. And to some extent, people are asking, how come these experts don't have all of the answers? And that I've witnessed as almost undercutting people who work in science. You want to speak a little bit about how science works and how it's iterative?
Yeah. Happy to. First of all, I actually had a disclosure I probably should have given to all of you before I started. And that is, I actually know less about this virus today than I probably did 10 weeks ago. And the more we learn, in many cases, the less we know. And I think that willingness to just tell the public this is what we know and don't know, and this is why we know it and why we don't know it is also important so that they can understand as we gain new knowledge what this all means. You know, science is an iterative process. It's a self-correcting process. You know, you may find certain discoveries or collect new information only to find out within continued additional information that maybe that wasn't quite the way that thing worked. And now we can understand why the initial data were incomplete or the conclusions were not in keeping where we're at now. Science is never absolute in the sense of saying this is the final issue. You know, we even today, something as simple and yet as complicated as gravity, you know, we talk about what impact that has on things airplanes fly. And so it's a challenge to understand some of these topics, but in science, it's all about research. It's all about trying to understand and test hypotheses. Why do certain things happen? Why not? With this virus, we're doing that every day. Why is it that it transmits a certain way? Why is it that some people get really sick and others don't? Why is it that when we look at the virus, it's changing or not changing in a way that makes us worried it may mutate into something better for us or worse for us? We don't know. And so that's really the science process, and it should be without value. And what I mean by that is life is value. But the bottom line is that it shouldn't be partisan. It shouldn't have impressions. It shouldn't have feelings. Science is cold. It's just absolutely cold, you know, and I think if you want to understand the importance of science, just think back to those medieval cathedrals that were built in Europe and other places around the world. That was science that was able to get those tons and tons of rock to stay up there in these big, huge ceilings. Even back then, science was critical to understanding how our world should work and what it does. So in this case, we're trying to do that. As you've alluded to, there have been a lot of challenges with that in terms of a lot of partisan considerations coming to play here. And the public is not well served in that setting. The public needs to be able to understand that what we're telling them are balls and strikes. We're not here to see who wins the game. We're not here to advocate for who wins the game. We're here just to call balls and strikes. And that's our job. And so I think that's the approach our center has always taken. Surely it's the approach that I've taken. Mm-hmm. And I think that's where we have to continue to keep moving forward.
No, that's a great point, and I wanted to pick up on that. I've often stated that the virus does not really care if you're Democrat or Republican. It likes you and it wants to get inside of your body. As you studied H1N1, and I have to imagine you've studied over the course of a lot of years modeling and playing out scenarios if something like this should hit. Were there the sociological factors? I mean, did you ever look at people's wanting to be social and belong and hug others. I mean, it happens within our own families and friends where you just want to hug them, but you know you shouldn't. And which wins?
Yeah.
Did you ever model any of that behavior?
Well, yeah. Well, actually, I did. First of all, let me just make a comment on your comment. I agree with you wholeheartedly about this virus doesn't distinguish between individuals as such. It does surely cause more severe illness in older individuals, people who have underlying health challenges, but on a whole, you're right. And I've said from the beginning, there won't be blue states or red states. There won't be blue counties or red counties when this is over with. It'll be COVID colored. And that's what's happening right now. In Minnesota, as an example, if you look right now, some of the most dynamic transmissions occurring in our state is occurring in greater Minnesota, a long ways from the urbanized area of the Twin Cities. And so this is a huge challenge. In terms of the distancing issue, knowing that in fact that this is transmitted by breathing someone else's air, let me make a friendly amendment to the comment you just made, because your intent is right on the mark. I tell people, don't ever socially distance, never physically distance.
Mm-hmm.
And this is a time when we need to be more social than ever.
Yes.
And the other thing, our group is doing a lot of work right now with infectious dose, looking at just how much virus you have to inhale in before you can get infected. Mm-hmm. And when we look at that as we've come to the conclusion that, this time duration dose issue is such that, if I want to see my grandkids once a week, as I do, I can go to an outdoor area, a park, and I can walk up and give each one of them a hug for 20 to 30 seconds, hold them tight, and then back off and stay at least 10 feet away in the outdoor air. And I feel very confident that I was safe in doing that in terms of the actual dose that would be required for me to become infected, if in fact one of them were infected at the time I hugged them. And so I think in that regard, we also, in part of living with this virus, we have to learn what are the things we can do safely. I worry that too many people feel like the face cloth coverings are absolute protection. I advocate wearing one, but when you're in public, distance is still the most important thing. And the other thing is, we have this mistaken belief. If I know somebody, well, they can't be at risk. I can't tell you how many outbreaks we've had recently where it's at weddings, it's at funerals, it's at family events, where everybody said, well, I knew everybody. Nobody was sick, and yet somebody was infected there. And I know of graduation parties, I know of weddings and funerals, where additional people who were there also not only subsequently developed infection, but died from it. Imagine you're the individual that brings the virus home on Father's Day to your father, and that your father eventually not only becomes ill, but dies from it. We've had way too many of those events. So the other challenge is you have to assume everybody who has got a heartbeat, everybody who's doing a little breathing is potentially someone who could be infected. And that's where you got to keep your distance and use the advantage of things like outdoor air versus indoor air to help you with that very issue.
No, you've actually answered an audience question, if you will, that was asking, okay, how many asymptomatic people are there out there? And your response is really treat everyone as if they have it.
Yeah, and right now we suspect that anywhere from 30 to 40% of people never get sick enough to know that they even have this virus infection. Mm-hmm. And of those that do get sick, it doesn't mean that they can't transmit in the earliest hours before they get sick, after they become infected. And so that's a real challenge. And that's why, again, you have to treat people. Now, if you're potted up together, as I am with my partner, at that point, we can do things together. We urge that if people really want to try to socialize during this time with others, then you've got to guarantee you're not having exposure elsewhere. So, for example, within a retirement facility, if no one else is coming in from the outside, or that you're having that contact, no reason why, several residents can't get together every day, as long as they're potted. But as soon as one of those residents starts having outside exposure, then in fact that changes the equation. So what we're trying to do is create an environment where as many people as possible get to experience everyday life. Loneliness has been a terrible problem during this time. Mental health issues have been huge. And so that's why I keep coming back, is we want to physically distance, not socially distance.
That's a great statement. We've got, most of the people on here have the ear of mayors all over the United States, Canada as well as councils. And as we've spoken about, this issue has become somewhat political as well. How would you recommend our members as public works professionals speak to elected leaders about this issue and public health?
This has been a real challenge. Many of my colleagues have either been fired or have quit their jobs in public health around the country as city, state, county public health officials, just because of what they've had to put up with in terms of literally physically threatening situations, as well as just from a professional standpoint, such abuse. I myself have received threatening notes and letters just by taking the positions that I've taken. This is a climate like I've never seen before in my 45 years in public health, never. HIV/AIDS, I can list a whole number of things. Nothing is like this. And this is a real challenge. I can tell you that we have more and more situations, though, where we are seeing, quote unquote, I guess I'd say some conversion of issues when individuals who are adamant that this pandemic was a hoax, that this pandemic doesn't affect most healthy people, only to have a member of their family die or they themselves die, and to see what happens when that occurs. And so I think that, the proof is in the pudding that way. I hate to say is the fact that you will know people, more and more people who will get seriously ill and who will die from this virus over the course of the next months ahead. It would be a terrible reason for why at that point you then start to take it more seriously. But, at this point, that's what's going to happen. And so right. I think just advising your leaders and your communities that, it will be difficult. It will be volatile. It will be very personal. And you all serve in public service areas, where sometimes it can be tough by the type of response you get from the community when, but for you, they wouldn't have, much of the life that they own today. And so I think that's the hardest part, is just trying to do the best for the community and not always being appreciated for that.
Thank you. I want to respect your half hour. I have one last question.
Sure.
Most of the news anchors that have you on push you to place blame. I've watched Don't Blame. Somebody shared their screen, so I'm lost. Okay. You don't blame. You speak about, okay, what happened at the start of it happened. And you've been speaking about what are the next steps, how do we move through this? You want to wrap up by sharing what your thoughts are about where we should place our focus and what the next steps are?
Well, yeah, it doesn't help to go back and litigate what did happen and now. What we have to focus on is what are we going to do to get through the next 6, 12, 14 months. And I think that's the point of what we've tried to do, is really focus on that, knowing that, more and more Americans every day are going to succumb to this. Right now, we're averaging between 600 and 1,000 deaths a day. We're seeing case numbers build up into the lower 40,000s again per day. And that's only a sample of what's really occurring out there, because we know we're missing a number of infections. And so our job is every hour on the hour. I mean, you have to understand that when you think about, the number of people who are dying, just on an average day, just in the time I've given this talk, 55 to 60 people have died just in the time I've been on here with you. And that's what we have to focus on. That's where we need to keep our eye on the ball and move forward. And, that's what I'll continue to do the very best of my ability. And, for another reason, and in a very selfish way, and it is selfish, this is about my kids and grandkids, so I'm going to do what I can, however I can, to have a safer world for them. And just by chance, I hope that makes it safer for everybody. So
Well,
I'd leave you with that. And I just would thank
thank
you
you.
again for what you do. Thank you, all of the
you.
public works people of this country. Every morning I take that shower, et cetera, et cetera. I actually do appreciate you more than you know. Thank you.
Well, thank you. There were questions asked in the chat that we weren't able to ask. It's only a half an hour. You were not ignored. Some of them focused on aerosol and masks and droplets, which you answered. And there's one that was asking, when you speak about people will die, the question is from what? I'm assuming you mean from COVID, right?
COVID, this has been a misunderstood issue. Let me just clarify this, because people have really abused this issue. If you look at the death certificates of the 195,000 people who have died, only about 10,000 just list COVID. People say, see, only 10,000 died. Let me give you the analogy. I live somewhere where I have dense brush overgrowth. I have astronomically high temperatures, very low humidities, and I have incredible wind. Okay? But if I live there every day like that, I'm fine until somebody puts a match to that. And when that match comes through, it surely is enhanced in how it goes through your communities if you have the low humidities, the wind, the high brush content, et cetera, all of that. Those are like the risk factors we have as humans. If you weigh too much, if you have underlying renal disease, if you have diabetes, you're not going to die from those today. You're going to die from them next week or next month. But if you put COVID in there, now you have a much greater chance of not just getting the virus, but dying. And so I think that's what people misunderstand. So of the 194,500 now deaths, COVID was what drove it. That was the fire. That wasn't the brush. That wasn't the wind. That wasn't the humidity. That was the fire. And that's what people misunderstand today, is that there really have been, and as we do more studies right now, we're seeing that there have been a number of COVID deaths that have been missed, a lot of them. On top of that, we have a number of people today who have died who didn't have COVID, but they couldn't get access to healthcare in some of the really hot areas when these outbreaks have occurred. So whether it be their strokes or their heart attacks, whatever, we see increased mortality right now in those same areas. So it's still, in a sense, an effect of COVID, even though COVID didn't do it. So I can tell you right now, there's no doctoring the data. There's none of that. It is really about the fact that these people are really dying from COVID.
Well, on that happy note, no, we appreciate you speaking with us. It's been great reading your articles, watching your statements on the news, and then to bring you with everyone here has been helpful.
Good.
So thank you, everybody.
Thank you all very much. Have a good day.
Okay.
Thank you. Bye.
Bye-bye.